Before Iris tells you our story, I would like to say a few words. I was working as an undertaker at the time of Richard's passing, a profession where you have to show care, sympathy and respect to the bereaved, none of which was shown to my wife and I when Richard died. It was a job I enjoyed immensely, which, although I found it difficult to continue with, I did do so for a year. On the anniversary of Richard's death, I realised I could not face the continuing reminders anymore. On the advice of my GP, I resigned. I have now been out of work for nearly 6 months. When people lose a loved one, they're always told, time is a great healer, but sadly those bearing the pain, this is not always so. The mental torment and grief that my wife and I continue to go through will have no end. I would like to read a few lines from the tribute that our eldest son Luke read at Richard's funeral. The words speak volumes. Throughout his life, Richard was completely perfect. Richard was entirely free from the ego and greed which drives the rest of us on. He did not know how to lie, cheat or betray others for his own gain. He did not know how to judge others based on appearance, religion or anything else. He only knew how to be totally honest. Our time together was too short, but you will be forever in my thoughts. I'll hand you over to Iris now.
We would like to start this meeting by telling you our story of the catalogue of errors made by the staff within the health service that we believe led to our son and Richard's painful and premature death. While Richard was a child, he received a good standard of care under the paediatric services. During this period, Richard's very complex needs warranted him open access to the local hospital. But on his 18th birthday, he was automatically transferred to adult services. Even though I had raised my concerns regarding this, open access was withdrawn. Richard's needs had not changed, but his level of care did. The first time Richard was admitted to the hospital under adult services, they failed him. Due to the appalling care he received, Richard died in pain under distressing circumstances, and he was denied the comfort of us, his parents, being with him. We were also not given the dignity of knowing Richard was dying. When Richard became unwell in the early hours of Tuesday, the 2nd of September 2009, he was obviously in pain and very distressed. We called the on-call doctor, who arrived very quickly, and after a thorough examination decided to contact the local hospital to have Richard admitted for tests. The doctor at the hospital refused to admit Richard due to the fact that Richard did not have a temperature and that he was handicapped. The doctor said Richard would be more comfortable at home. It is now over a year and the hospital still cannot or will not tell us the name of the doctor that made that decision. Our local MP and the Secretary of State for Health are also aware of this situation. Later that morning we took Richard to our own GP. By that time Richard had stopped passing urine. Our GP did not give Richard a thorough examination and made no attempt to read the out-of-hours doctor's report. He seemed more concerned about the questioning the fluency of the on-call doctor's English than treating Richard. Although our GP could give no diagnosis, he sent us away with nothing more than painkillers and advised us to increase Richard's fluid intake. Before we left his surgery, I asked him if Epilim could be causing the stomach pain. He replied, "I don't know why he's on it, stop it." Richard had been prescribed Epilim by the consultant psychiatrist who is based at the medical centre. If our GP was concerned why Richard was prescribed Epilim, surely, as Richard's GP, he should have consulted the consultant psychiatrist. Regular blood tests are recommended for patients on Epilim, but these were never carried out or suggested for Richard. Danny and I feel sure that had Richard been a normal 20-year-old young man who was capable of describing his symptoms, our GP would have sent him to hospital. By 5 p.m. that evening there was no change in Richard's condition, and by now he had not passed urine for 24 hours. I telephoned our GP and informed him of this. He told me to increase Richard's fluid intake and to carry on with the painkillers. Yet again he showed no concern over Richard's symptoms. There is a dispute over this conversation because the GP does not recall it in detail, and he said he was distracted with a patient when he took the telephone call. The GP did state at the meeting in January 2010, had he been aware that Richard had not passed urine for 24 hours, it would have raised a red flag, and he would have told us to take Richard to hospital right away. Instead, he told me to increase Richard's fluid intake and he would go eventually. Those words still haunt me today. When Richard was eventually admitted to the local hospital on the 3rd of September 2009 at 6 a.m, he was taken straight to the acute care unit. But at no time was there any urgency in his treatment. He was seen by inexperienced and unprofessional nurses, and Richard's vital signs, which did not trigger any concerns, were not recorded correctly. The observation chart states that several attempts were made to record Richard's blood pressure, but it was unrecordable. The BP cuff was far too big for Richard's tiny arms. We asked several times as to when Richard would be seen by a doctor, as at that point we were very concerned about the amount of pain Richard was in, but unaware of how serious his condition was. When a clinician eventually examined Richard at 7:15 a.m, she did not discuss her findings with us in detail. She wrote on Richard's medical notes, gastric enteritis as a possible diagnosis, which we were only made aware of after requesting Richard's medical file. Richard had no symptoms whatsoever that would suggest he had gastric enteritis. The clinician was unable to take blood samples. The fact that Richard's veins had collapsed should have alerted her to the seriousness of Richard's condition. She did not carry out any other investigations or treatment, preferring to leave Richard's care for the day staff when they came on duty at 8 a.m. Richard had not passed urine for 24 hours, and she didn't even ask for Richard to be catheterised, which we understand is a routine procedure. The quality of care Richard received on the ward was very poor. Richard was not being regularly monitored. Consequently, it was left to us to inform the staff when Richard's lips had turned blue and his legs went blue and blotchy. He was put on oxygen, which after a very short period of time we were told the mask could be removed, which we fear could have triggered Richard's cardiac arrest. The consultant of the acute care ward saw Richard at 9 a.m, 3 hours after Richard's admission. It was not until then that blood tests were requested. The test confirmed that Richard has septicemia. The consultant, now aware that Richard was terminally ill, walked away without discussing any treatment or appropriate care for Richard. He did nothing to save Richard's life. The consultant also stamped Richard's medical notes, medically fit for discharge date, the 9th of the 9th, 09. As upsetting as this is, we were told it is hospital policy. We still cannot see the logic of an unachievable outcome being put on a terminally ill patient's medical record. It is our opinion that the consultant decided that Richard's life was not worth saving. He did not return to see Richard for another 2 hours. By this time, Richard had suffered a cardiac arrest. The impersonal and callous manner in which the consultant informed us at the meeting on the 4th of March 2010, when Danny asked why Richard had not been transferred to the intensive care unit, was extremely distressing. The consultant's exact words were, "I knew he was going to die." In the way in which Danny was told about Richard's passing has had a lasting effect on him. It was confusing and unclear, as the doctors baffled him with medical jargon. He eventually had to ask them, were they trying to say Richard had passed on? The response was yes. There was no support or care given to us after following Richard's death. We did not receive the services of the bereavement officer because she was too upset. Richard was not offered the last rites, nor were we offered any pastoral care or even given a cup of tea. We were not asked if we would like to spend some time with Richard. I was in a very distressed state, and Danny had to practically carry me out of the ward. No one spoke to us or offered any help. The only person who spoke to Danny was the tea lady, and she asked him if everything was all right. We still find it hard to believe that the hospital staff just left us to leave the hospital without even inquiring as to how we were going to get home. Danny had to drive us home less than an hour after Richard had died. He was trying to console me and concentrate on driving. You can't imagine the turmoil his mind was in. Even after all this, we had to endure more distress. When our eldest son Luke, who at the time was working in China, came home on Saturday the 5th of September 2009. On Sunday the 6th of September 2009, Luke asked Danny if he could make arrangements for him to see Richard at the hospital. Danny phoned the hospital and was told that the chapel was not in use. It was undergoing refurbishment and would not be available for 6 weeks. There were no alternative arrangements in place for families to see their loved ones. We sent a letter of complaint to the then chief executive of the hospital, but in his response he said his staff had informed us of the situation, which was untrue, and it was not until we went to the press that we eventually received an apology. With regard to the complaint process, we did find the hospital administration staff very helpful, but there was a delay in receiving Richard's medical notes because it took the doctors so long to sign them out. The first letter was a very weak apology. It took months for the hospital to arrange our initial meeting, and not all the relevant staff were present, and those not present didn't even provide written statements. We received all of Richard's medical notes very quickly from our GP surgery, and the NHS Luton arranged a meeting with the GP within an acceptable time. We were, however, disappointed with that meeting, as it only resolved the clerical issues within the surgery and did not address any of the clinical failings that we raised about the GP. We still have questions raised in a letter that have never been answered. The minutes that were taken at the meeting were inexcusable. There were so many inaccuracies, it was hard to believe that the person who took the minutes was actually present at the meeting. It took months to achieve a reasonable, accurate account, and this was only after a senior manager at the NHS Luton directly intervened. It was disappointing that nobody other than the senior manager considered this important enough to intervene. Changes that need to be made. It is essential that doctors on call should always obtain the name of the medical person that they consult with. The hospital must improve their record keeping. Until the doctor who refused to admit Richard is identified, which is now highly unlikely, we have no way of knowing if this doctor was even registered. Transition from paediatric to adult service is in urgent need of change. Open access should never be withdrawn without first putting in place an alternative plan to fast-track vulnerable patients into hospital. Always consult with parents and carers about the treatment and care of vulnerable adults with special needs. Better training for medical staff in caring for patients with special needs. It is paramount that patients with special needs receive the same standard of care and are given the same right to life as you and me. What happened on the acute care ward on the 3rd of September 2009 was a living nightmare, one that we relive every day and will stay with us for the rest of our lives. The staff lacked the knowledge of how to care for a person with a disability, and when it was needed, we were shown no compassion. Richard dying has ruined our lives. Life for us has no meaning now. Richard was our life. He would never have achieved academically, but in some ways he achieved a lot more. Whereas all your doctors have given us nothing but pain and misery, Richard brought us only pleasure and joy, and to all those who were privileged to have known him.
Our little Richard, I mean, he was a real character, and there was a time where he was in a play, and we wasn't supposed to take any photographs or anything like that, but I couldn't help it. I sneaked a video camera in and I videoed it, and I'm glad I did now, because it's another memory. It was a happy memory, but there is a scene in it which I'd like you to see, to give you an idea what a happy chap he was, and it was to do with the Sheriff of Bedfordshire, because when the play was over, the Sheriff of Bedfordshire was handing out the Oscars, and every child, you know, the Oscars were about that size, every child got an Oscar and a certificate, and they were called out by name. And Richard was very tactile, so when it came to Richard, and the Sheriff of Bedfordshire, she leaned down, you know, because Richard was in a wheelchair, she leaned down to sort of say, you know, here's your Oscar, little boy, and she knelt down, and with his certificate as well, and as she went down, Richard grabbed her hair, like this, boop, 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 and it was so funny, and she come up, you know, whoa, you know, straighten my hair sort of thing, and I mean, she was all right, she was good about it, you know, but we found it quite amusing because we had an idea what might happen. And then she went back to get another Oscar, and then I kept the camera on Richard, and then as she sort of walked by Richard, and if you see the look on his face looking at her, as much as to say, I gotcha, you know, this was Richard. I mean, he couldn't talk, he couldn't hear, he couldn't walk, he couldn't eat. We had to feed him every 4 hours by tube. But he was just something else, and we were very lucky to have him for 20 years, and we miss him every day. We can go through this story all the time, and things will never be the same, because he was our life. Our lives were mapped out, and no matter where we went, Richard went as well. We never went anywhere without him. If he couldn't go, we didn't go. And that's the way it was. Before I tell you our story, I would like to say a few words. I was working as an undertaker at the time of Richard's passing, a profession where you have to show care, sympathy and respect to the bereaved, none of which was shown to my wife and I when Richard died. It was a job I enjoyed immensely, which, although I found it difficult to continue with,